Good evening and welcome to another new edition of Daily Debate. My name is Dina Hussein. I have all the pleasure to have with me today our prominent guest, Professor Gamila Nasr. She is Professor of Cardiology and Head of Scientific Council of the Egyptian Board of Cardiology, Head of Ismailiyah Medical Syndicate. Good evening, Dr. Nasr.
Thank you. Good evening.
Our real pleasure to have you today. We're going to be handling a very important topic, or maybe one of the best successes in Egypt's history, which is the health file. How far has it improved? It has improved because of a collaborated effort for more than 10 years now. Ever since President Abdel Fattah al-Sisi has stepped into office, he has been putting the health file right before his eyes. And you name it, the number of health initiatives that were launched according to the directives of President Abdel Fattah al-Sisi to alleviate and to empower and develop with the health situation of the citizens, the elderly, the women, the children, and every single citizen in Egypt had the best interest and best benefit out of these initiatives. And of course, the initiatives are very popular. Together with these initiatives that has been made and that has reached every single corner of Egypt, even the most rural areas were reached by those initiatives. But also, together with these initiatives, also the government was keen on also stepping up efforts each year and each month to be able to develop with the care system, with the healthcare system, to develop with the number of hospitals, the huge number of modern new hospitals that were established in the past few years are not little. There were so many, and every time a new government was digitalized, was built, was developed, there were a number of hospitals that were established with this government. Today we're going to be discussing that very important file and more. Make sure that you join us in this edition of debate and talk about the development of the healthcare system. And now it's Egypt's Universal Health Insurance Authority adds over 100 medical services. More details in the following report.
Egypt's Universal Health Insurance Authority, UHIA, will add over 100 fresh medical services for its beneficiaries within 6 months after agreeing with the providers from both local and sectors on the prices of such services. The system's price list currently covers 3,000 medical services extended to their subscribers. The current project portfolio in the Egyptian healthcare sector includes 32 projects worth $1.4 billion that serve Egypt's Sustainable Development Goals (SDGs) strategy, particularly the SDG 3 focusing on achieving good health and well-being. Egypt launching the Universal Health Insurance System in 2019 to be applied in 5 governorates: Port Said, Ismailiyah, Aswan, Luxor and Suez, with an aim of extending high-quality medical services to the public without discrimination at affordable costs for the entire family. President Abdel Fattah al-Sisi ordered the launch of the first phase of the implementation of the National Health Insurance Project, which includes the governorates of Port Said, Ismailiyah, Suez, South Sinai and North Sinai, with preliminary steps and procedures at specific times and timetables according to the following: eliminating waiting lists for patients that need critical surgeries and medical interventions within a 6-month period; launching the Model Hospitals Development Project with a total of 47 hospitals in all government Egypt, which is affiliated with the Ministry of Health and University Hospitals; providing strategic stocks of infant formula and vaccines; scanning and comprehensive treatment of hepatitis C virus with a total of 45 million Egyptian citizens in partnership with major drug companies within 2 years; completing the preparation and mechanization of Port Said Governorate in terms of constructions and equipment, preparation of manpower, inventory and registration of beneficiaries within a year, provided that the implementation will start successively in the remaining governorates of the first stage, Suez, Ismailia, North and South Sinai. The project also aims to reform the entire healthcare system, not just the health insurance sector, in addition to providing healthcare services for all in order to achieve social solidarity between members of society, besides providing a good health service that covers all diseases. It also aims to amend of household spending that directs 60% of its income to be spent directly on health, knowing that the law will be applied in 6 stages that cover all governorates of the Republic and work to reduce poverty and disease rates. The project focuses on providing full medical protection for the entire family, and those who can afford the fees shall pay for this service. However, the public budget will cover the costs of the families that cannot afford paying. It is a social symbiotic system through which high-quality medical services are provided to all groups of society without discrimination. The expenses of those who cannot afford paying will be borne by the state. The system includes an integrated package of diagnostic and treatment services, and also allows the people to choose health service providers. It aims to reduce personal spending of citizens on health services and reduce poverty due to disease, contributes to the pricing of medical services in a fair manner, and the patient's access to the service without resorting to additional procedures.
Welcome back, and like we said, we're very delighted to be having with us Professor Gamila Nasr. She's a professor of cardiology and head of the Scientific Council of Egyptian Board of Cardiology, and also she's head of Ismailia Medical Syndicate. Good evening, Dr. Nasr. How are you doing?
Good evening, and I'm very happy and proud to be in this episode, and we hope that we will discuss a lot of issues about the health in Egypt.
Hopefully, inshallah. That's what we're looking for, especially with someone like you.
Thank you very
much.
It's
a real pleasure to have you, Dr. Nasr. And let's first embark over the health file in general. Before we start off, the health file and the educational file was one of the main challenges for any Egyptian president, because we had a revolution that erupted because of health file and educational file. These were very, very difficult challenges. It needed a strong president who has plans set up and who also have ambitions. And that's what President Abdel Fattah al-Sisi have been starting slowly, step by step, to work on. And he chose the most important and most vital file for the country and for the citizens, which is the health file. Without better health, without good health, no development could be achieved. No citizenship could be taken, no projects, no development, no economy, no culture, nothing. So talking about the health file, and we need to trace it since probably the early beginnings. He had a plan and he had a vision, and he started off by thinking of something unexpected, innovative. Nobody have ever started thinking about it before even developing with the governorates and establishing hospitals and everything, the health initiatives. He started off with the health initiatives. He started with 100 million lives, and before it there were minor health initiatives as a trial. It was for women and was for children, and there were several checkups over health of citizens' health all over the Egyptian governorates. That was a very good network of planning. If you like to elaborate.
Well, I agree with you, because there were major changes in how the government looks at the issue of health in Egypt, and definitely the president point of view was totally different because he thought of prevention, and I think this is very important. The issue of prevention is really very important, and when I'm telling you that it's called the Ministry of Health, and it's not called, it's the Ministry of Disease, so you are just talking about the health of people. This is very important. And on the other hand, when I'm talking about the Egyptian health profile as well, and the health map of Egyptians, definitely, we do have not very good numbers because maybe Egypt is ranked number 25th all over the world for heart disease, one of the highest risky areas for heart disease. It's one of the 10th countries, 10 most highest 10 countries all over the world for some disease like diabetes, for example, obesity, again, hypertension as well. So we do have a lot of challenges, as you have said, and of course when we are talking about Egyptians, maybe the Arab world as well, do they die? Should I ask a question? Do they die from infectious diseases or from chronic diseases?
That's a very, very important question.
Definitely, because
what difference does that make in the analysis? I mean,
this is very important
planning.
because when you are talking about it, we say that 86% of the Egyptians die from chronic diseases. This is
it's because of bad nutrition, bad habits, and because the environment, pollution.
The key is lifestyle. And if
it's all relevant.
What are the chronic diseases we are talking about? Heart disease, we are talking about cancer, we're talking about diabetes, hypertension, chronic obstructive airway diseases, obesity maybe now is called a disease as well, diabetes, of course. And when we are talking about this, we are telling that fortunately, all these diseases are having common risk factors. So, when you are exercising in a proper way, maybe taking around 30 minutes a day for 4 days a week, probably you are preventing 20 chronic diseases. So the key is the risk factors. So this is what the government has started to do, look for these initiatives, looking for the risk factors. This is for the first time, and doing initiatives, campaigns, looking for the risk among Egyptians. This was very important because there was a trial to get a health map of the Egyptians. How many of them are hypertensive and they don't know how many of them are diabetics, how many of them are obese as well. And we had very clues, we had very important answers about that. So the campaigns tackled millions of Egyptians, and this was very important. Now we already have data. When you are building a health system, you need to have data. So this is what was done in the era of President Abdel Fattah al-Sisi. As we know that built a lot of data. We have prioritization of health problems among Egyptians, and so this is very important. And I suppose this is one of the key factors that led that we had the COVID-19. It wasn't very serious in Egypt. It was much less than anticipated. Maybe the complications among Egyptians, the fatality rate was much lower than expected, and this was very important. Maybe one of them is adopting the healthy lifestyle, building a lot of hospitals, modern hospitals, and establishing a health system. So I think there was not a huge breakdown of the health system in Egypt in the era of COVID-19, and thanks God this was very important. Also the file of health, fortunately I have to say a very important issue that you can prevent 80% of chronic diseases. This is very important issue. 80% can be prevented. Through what? I'll tell you just a very scientific equation, and this was published by the European Society of Cardiology, and states that if you you needed to be healthy and to have a healthy life, what you need. You just put an equation, and it's like a number of Alexandria, 035,140 530. What does this mean? 0 stands for no smoking, and we know that smoking definitely is a real threat. When you're smoking a cigarette, it will cost you around 11 minutes of your one cigarette. Maybe you will have your life last by quarter of 10 minutes or 11 minutes. So this is one important issue. 0 stands for no smoking. 3, you have to walk 3 kilometers a day or 30 minutes in a moderate activity 4 days a week. And 5, you take just 5 portions of fruits and vegetables, maybe of different colors, as having antioxidant properties. And you will take it just every day, and be sure that your vegetables and fruits will be of different colors. This is very important. 140 stands for the issue of hypertension, which is really very important. 53 stands for lipid profile and dyslipidemias. 0 stands for diabetes, presence of diabetes and presence of obesity. So this is what the government have said. It looked for the diabetes, it looked for the obesity, it looked for the hypertension, dyslipidemias as well, and discovered a lot of new cases. Many patients were astonished. I don't say patients, many people who they thought that they don't have any disease before were discovered to be hypertensive, to be dyslipidemic, to be diabetic, and this was very important. So it's a revolution of awareness. This is very important. I think this is the best achievement which has happened, because it changed the scope of health in Egypt from being treatment to therapy to prevention.
But then let me stop at something very important that you raised here, which is the awareness. The awareness is something that could be a core pillar when it comes to setting a foundation for any file. Awareness, especially with health. If you do not set awareness campaign, if you do not educate people about the factors of good health, then nothing is going to work, no matter how you treat them. No matter good hospitals are established, since they don't have the awareness of nutrition, the awareness of leading a healthy life, not smoking, know how to jog or strut, or maybe walk easily or swim or whatever. Those important factors are vital for any health plan. But then President Abdel Fattah al-Sisi have started with this awareness factor, and he chose the kind of campaigns to start off with. He, for the first time in history in Egypt, he had campaigns that would make pre-marital checkups for people who are about to get married. Also health campaigns for targeting women or mothers and their kids, because they are the foundation of any society. Also obesity. He was also keen about obesity. Those were ideas that were really not familiar to the people in Egypt, to the citizens. They could not really absorb it at the beginning, but as soon as it unfolded, the results were amazing. And later on followed the huge other campaigns that targeted in 2023 11,005,000 beneficiaries, 100 million lives. How do you see this?
Well,
11 million.
I have witnessed this by myself, because I do have the honor to be member of the Committee for Health of the National Council of Women of Egypt. So I witnessed this by myself, and I have seen ladies from many initiatives for women, and this was very important. We are talking about women. You're talking about the whole.
Did you notice any increase, any development, their awareness?
Definitely.
Comparing
Definitely.
from back then and now?
Definitely, because as I've said, in the National Council of Women, the health sector, we have gone everywhere in the country, coming from Alexandria back to Luxor to Aswan, and we have met a lot of ladies there, Egyptian ladies. These Egyptian ladies coming from very rural areas. They don't, maybe some of them were not educated by a degree which is very, very high, and we found that they're becoming aware. I have been to an area which is in the southern area of Egypt, and I was very amazed by a lady there, and she's totally changed. She's talking about health in a very important way. And do you know, I'll tell you a very important item, that's the engaged patients. Now we are talking about, we do have actually 6 types of patients. 6 types of patients. Some of the patients just very passive, and he don't like to talk with the doctor, just obeying orders only. And there is another patient who is aware. There is another patient who wants to know the details. Another patient who needs to be convinced. Another patient who needs to be engaged. So when you are talking a medical decision, you need your patient to be engaged. So what happened in Egypt in maybe the few years before the patients becoming a little bit engaged? So I know that I am diabetic, I know that I am hypertensive, dyslipidemic, so you are engaged in treatment. How can you improve your medical situation? Just you are engaged in a way or another to improve your health, either by lifestyle or either by medications. So I think this was really very important, and I think a major change in the viewpoint of health in Egypt. Also, I'll tell you, it's very important, we have the boundaries of one of the very successful stories, and it was maybe witnessed by the whole world and selected as a success story in the whole world, being the hepatitis. Hepatitis, you know, hepatitis. Egypt was able a few years ago to eradicate the hepatitis from Egypt. Not only this, but it actually, you know, it was that in Egypt it had gone to Africa as well, and you know, the boundaries or the borders in Egypt have been widened, and what happened that we have gone to Africa, and Africa, there was a care for the African people. Maybe more than 1 million African had a great benefit from the initiatives of Egypt of treating hepatitis. Maybe they provided medications to them, and actually did a lot
of course, hepatitis C, it's a milestone. It's one of the, we became renowned by conquering hepatitis C and then manufacturing also medications for that. I mean, correct me if I'm wrong. We're going to be moving on to those important milestones in the health file later on. But then as a start, the health initiatives and the president taking over his shoulder as one of his main targets to provide health insurance.
Yes.
And start with the governorates first before the capital. And we remember very well that Port Said was the first one, an excellent health insurance campaign or system was implemented and followed on later on by the rest of the other governorates.
Definitely.
How important is that? How have that changed the face of the health file in Egypt?
I'll tell you a very important issue, that a major changes, and we are all proud of them. I do have the honor to be one of the members of the Universal Health Insurance System since Malaya Governorate, and I'm very proud of this. I'll tell you very important that a major change have occurred in this issue. Currently, 58% of the Egyptians are covered by the insurance, but what they aim in Egypt, the target is to cover 100%. So this is very important. Also, you're able by the Universal Health Insurance System to get the best quality. If you are not able to pay for that, you are having, you know, the others can pay. So it's some of a collaborative system, so that the rich can help the poor to get the highest benefit. And myself, I tell you, because I'm a professor of cardiovascular medicine and cardiology, in the Universal Health Insurance, we did the very sophisticated types of intervention, which we didn't dream before to be delivered to very poor patients. For example, doing the TAVI operation, this is the implantation of aortic valve via the catheterization, which is very simple maneuver. It's not, sorry, I don't mean very simple, it is not harmful to the patients, and we are doing this maneuver to patients around 90 years old, maybe 80 years old. This is amazing. It just costs around 700,000 Egyptian pounds, where the patients just paying 300 pounds.
Really?
Yes, so this is in Egypt, we did this, it's now here. So you are just offering, all medications are offered in the universal health insurance. Also, we are talking about the language of future. So now we are talking about the digitalization. And this is very important.
Said also was the first.
Of course, digitalization.
Digitalize.
Yes, very important. I think that digitalized medicine is really very important.
Digitalized even hospitals and even
yes,
operating surgical operations. I hope we have time to touch on that, because that's, you kindly raised a very important point. But first, it's the Ministry of Health launches the national campaign to detect health issues, and we have more details in the following report.
As part of the state's keenness on maintaining households and society, the President's Egyptian Women's Health Initiative was launched to promote the health of Egyptian women. Women were targeted in particular as a bracket in dire need of health education and care. The World Health Organization statistics have alarmingly revealed the high incidence of breast cancer among Egyptian women, which constitutes 35% of all women cancer cases. The initiative is designed to screen carcinoma of the breast at an early stage for 28 million women government-wide, pursue clinical examination, and provide free of charge treatment. In the same vein, reproductive health, family planning, and healthy lifestyles remain at the core of the initiative. Detection of non-communicable diseases such as diabetes, blood pressure, and obesity constitute an integral part of this endeavor. Risk factors of non-communicable diseases and breast self-exam are further considered. Ending waiting lists in another presidential initiative to alleviate the suffering of patients. It is based on alleviating the suffering of the impoverished and performing urgent and critical surgeries at the highest quality and soonest time. Operations are performed in government, public and private hospitals without the citizen bearing any financial burdens in order to provide a decent life for the Egyptian citizen. Initiative objectives: ending patient waiting lists for medical interventions, providing high-quality medical services free of charge to all patients equally, reducing the suffering of impoverished patients on hospital lists to undergo different operations, raising the level of performance at hospitals to provide the best medical services to patients, offering continuous training to the staff, and providing hospitals with supplies and modern equipment necessary to perform surgeries. Constant development of the automated system to facilitate the follow-up and extraction of data within the initiative. Out of the state's keenness on maintaining health of coming generations, the Ministry of Health launched the national campaign to detect health issues such as stunted growth, obesity, and anemia among school children aging between 6 years to 12 years old, and that students found with these diseases would be referred to medical committees with the health insurance system for free treatment. The initiative targets primary school students across Egypt in public, private, and Al-Azhar schools, and will take place on 3 stages. The first phase will take place in the governorates of Fayoum, Damietta, Asyut, Matruh, Port Said, South Sinai, Qalyubiyya, Bahira, Alexandria, Qina, and Giza. The second will be conducted in Cairo, Suez, Ismailiyya, Kafr al-Sheikh, Munuf, Bani Suef, Suhag, North Sinai, the Red Sea, Aswan and Luxor.
Welcome back, and of course our prominent guest is still with us here live in the studio, Professor Gamila Nasr. She's Professor of Cardiology, Head of Scientific Council of the Egyptian Board of Cardiology, and also she's Head of Ismailia Medical Syndicate. Dr. Nasr, we said that we're going to be moving on, as we only have like 9 minutes left, or 10 minutes hopefully, moving on to also one of the most important highlights of the health file that we Egyptians feel very proud. And thanks to you, because of all those efforts. The initiatives that were taken or initiated by President Abdel Fattah al-Sisi, as he planned, and people were really estranged back then at that time. There were initiatives like impairment, hearing impairment, like you said, the chronic disease, hereditary disease, the detection of virus C, maternal and fetal health. We have also anemia, obesity, genetic disease, newborns and all that. Those were really unfamiliar for any doctor to be able to think. Usually initiatives would come for cancer, for disease like the infectious disease, even in developed countries. It was something extraordinary.
Yes, definitely. As you have said, it's just extraordinary, and you know, it's out of the box thinking, so that you're looking for causes that may form of disability for the Egyptians. And I think the way they think now for health in Egypt, I think, is amazing, and I think this is the right way. And you are just looking for the babies, looking for their health in different ways. The women, again, the senile people, and there was for the elderly as well, very important items. So I think this is specifically what we call in the medicine the special population. And I think this is the way they are thinking. They are talking about maybe muscular dystrophies, hereditary forms of muscle disease, and I think it's very unique. But actually, I'll tell you something, that when you are talking about the health of a nation, you think that you can invest in the health of people, and I think this is the best investment. So
those are the words came by President Abdel Fattah al-Sisi,
yes,
when at the first stage when he was promoting for the...
Definitely, you invest in patients' health. And I'll tell you something, there is a triangle which is very well known by the whole world, which is called Maslow's hierarchy of needs. What's this? It's the triangle of how you can conduct your life. The base of this triangle is just looking for your physiological needs. You want to stay where, you should have which car, you have your needs, what you want to eat. When you just go in the triangle, you look for the being safe. So when coming here, it's the safety. Then the next step is belonging to your community. What is the top of this triangle is to create and to fulfill, and you have achievements, really good achievements. If you want a nation with people that really need to do something and create, they have to be on the top of the triangle. If they are not healthy, probably they will not do, because health is really, as we all know, nothing will be done without a proper health.
Right. How important was focusing on those types of initiatives was beneficial to the other main, huge other initiatives that followed later on? I mean, was it important? How important how do you assess the obesity initiatives, the newborn?
Amazing. Just looking at this like a puzzle, and it's just like a blueprint. With blueprint, you just, you're filling the defects everywhere in your population. This is very important, and I think it was very wise to do this. You're looking for just a unique way of tackling disease and a unique way of preventing disease, and definitely this was very important. And On the other hand, there was a very important issue regarding the use of artificial intelligence. This is another way. The world is now talking about artificial intelligence. Actually, in the universal health insurance, we are using to some degree the artificial intelligence in many situations. For example, in the echo machines, where you are able to look for the cardiac function by the artificial intelligence operated echo. This is, so you are getting very good devices, very good instrumentation, digitalization of health, automation of health services, as well as our awareness and prevention. I think this is a very unique, harmonic organization of the health system.
Right, but then again, the successes are too many in this file of the health initiatives. Like, for example, during COVID-19 and later on, and as the COVID was repeated, Egypt was keen and succeeded in manufacturing a vaccine that was competing with the universal vaccine that was made by China.
Yes.
And also the hepatitis C or virus C medicine that was manufactured for the first time.
Yes, eradicated as well. You don't have
and
hepatitis C
celebrating the total eradication that Egypt is free of hepatitis C, right?
Yes, this is right, and it's a perfect success story.
In very little time.
In very little time.
In how long?
Yes. No,
2 years?
Just 2 years or something or so. You maybe and in the National Council of Women, the health sector, we celebrated that because you said.
So we stayed 60 years.
Yes.
Struggling with hepatitis C, and then
I'll tell you a
in
very
2
important
years.
issue. How old are the Egyptians? They are becoming much more older. They live longer. So this is a measure. This is a measure of how health is
that goes back to good nutrition? Can we relate that?
Because I'll tell you something, to the awareness, to the very good health facilities, it's one of the causes, the awareness. Again, you give health services. Now we have, you know, maybe in the 50s, we do have the median age around 48. Now the median age of Egyptians around 76. So this
and
is
healthy 76.
Yes, they live maybe the median age. Now we have a lot of Egyptians who are living for 80 years, for 90 years, maybe even more. You didn't witness that before. So this is another measure of how health is improving. You do have a measure, you have an outcome of what you do. This is another important issue.
Unfortunately, we only have like less than 1 minute, but then I cannot end this episode without even mentioning that even the health initiative have expanded to our brotherly nations, our brotherly countries in Africa, stretching our hands to also help them over there, right or wrong?
Yes, it's right. I've told you that that we maybe more than 1 million African have gained a lot by this initiative, and this is very important. So it just
Are we planning one more?
Yes, I think so. Yes, yes, definitely. There
for
is
African countries?
a strong, project towards the African continent, and this is very important. I myself, I do have the proud to be the Africa continent representative in the International Society of Cardiovascular Disease. I've been elected by the African continent, and definitely we are trying to do a lot for the sake of the African, because Egypt is definitely a very golden country in Africa.
So proud of you, Professor Gamila Nasr, really so proud. You're a real pride to Egyptian women, and unfortunately I'll have to end it here on a promise.
Thank you.
That you could annex this episode with another one. That you could elaborate on more health successes. Our real pleasure. The pleasure is ours, of course.
You know, I'm very happy to be with you because you're such a very elegant.
Thank you so much.
Egyptian female, which is
thank you so much.
Definitely we are proud of you so much.
Thank you so much, Doctor. Professor Gamila Nasr, Professor of Cardiology and Head of Scientific Council of Egyptian Board of Cardiology. You're also Head of Ismailia Medical Syndicate. Thank you so much for coming to Daily Debate. And by this, we come to the end of this edition of Daily Debate. Thank you very much for joining us, and see you soon tomorrow.